Hi, this is Chris Antrim with Chris Antrim Insurance in Boise, Idaho. Today we're going to be doing, going over the basics of what healthshare plans are. So I am based in Boise, Idaho, but I can work out of multiple states across the country, especially with healthshare plans. So feel free, if you're watching this, to reach out to me. The first thing to really know, these programs can really be worth comparing, but they're not traditional health insurance, so it's important that you know that. In this video, I'm going to walk you through how they work, where they may fit, and a couple of things you need to be careful with before you would look at joining one of these programs. So the big thing to really understand is a healthshare plan. It's not health insurance. It's not traditional health insurance. It may act a little bit like health insurance, but it's not governed by the Department of Insurance in any state. And the way they work, usually it's a membership program where the members contribute monthly amounts that may be used to share eligible medical expenses. The important word is eligible. Each program has its own rules, exclusions, waiting periods, and sharing limits. So if a bill does not meet the guidelines, it may not be shared. So that's something really important to recognize and understand. Most of the programs follow what we call a review and share process. So it would look something like this. You're paying, you're paying a monthly membership amount, and then you go in to receive medical care. So the provider, they may bill you as self-pay, and then you would have to submit the bills to the healthshare program, or they may work with the program itself. Almost all of these healthshare plans have a billing code on the back of the card that you can ask your provider, send the bill here. Some will, some may not. Now, once the bill is submitted, it gets reviewed, and if it meets the program guidelines, eligible expenses may be shared after your membership responsibility is met. Now, membership responsibility, the way to kind of think about it, you can't technically call it a deductible, but it looks and acts like a deductible. You have a portion that you have to hit for certain eligible provider expenses, and then the plan would kick in. But not every plan works the same way, so it's important to understand that. Okay, healthshare versus ACA coverage or marketplace plans. You need to know they are not the same. So this is where people can get really tripped up. ACA marketplace coverage is regulated health insurance by the State Department of Insurance. Okay, it covers pre-existing conditions. It includes essential health benefits, and the big one, you may qualify for a premium tax credit to help offset your monthly premiums based upon household income and the size of your household. Okay, now a healthshare plan, they may have lower monthly costs in premiums, but it doesn't carry those same guarantees. So it's very important to understand that. The lower monthly amount is only part of your decision when you're looking at a healthshare plan. Okay, so for healthy individuals, healthy families, healthshare plans can be a great option, especially if you don't qualify for a tax credit. Okay, they're great for families, self-employed folks. Great option for people who are self-employed, contractors, early retirees. I work with a lot of early retirees. We might have a gap of 6 months to a year or two before they get on to Medicare. These programs can be amazing, especially if you're overall healthy. Okay, but it doesn't mean just because you fit into one of those categories that this is going to be the right choice for you. Again, I always like to talk to my clients, really walk through this so that you understand how the plans work. The one thing I can tell you though is I do this a lot too. I'll have some folks that go into a health share plan. They're healthy. Their health may change, and sometimes I have to switch them to an ACA plan during open enrollment due to their health that has changed. So, and every year you do have that open enrollment opportunity in every state. The timing's a little bit different from state to state and nationally, depending on if they're state-based exchanges or federal marketplace exchanges. Okay, if you have some medical issues right now, a health share plan might not be a good choice for you. So if you have pre-existing conditions, if you have expensive prescriptions, pregnancy or maternity needs, a scheduled surgery, or if you're seeing a specialist regularly for care, or if you have frequent claims, this might not be the plan for you. Okay, these plans overall, you really want to be pretty healthy. And that's when these plans work really, really well. So anyways, let's think about that. Okay, some questions to ask. Is this insurance? No, it's not what we'd call traditional insurance. Every plan will have different things that are excluded. Most plans will not cover pre-existing conditions. Okay, most plans on prescriptions, it's not a traditional prescription drug plan. It looks more like a discount prescription drug plan, kind of like GoodRx. And then of course, if you're planning on getting pregnant, so maternity care and pregnancy could be a very important consideration. Mental health services included, typically not. Now here in the Boise area, will your doctors and hospitals build a program? And that's pretty much nationwide. That's a big thing that you really need to know. There's a couple plans out there that they, in essence, piggyback off a traditional health network, which is very large, and I can talk to you about that. So some hospitals, and I do have a program here in Boise where St. Luke's, St. Al's would be considered in network, so which is very, very attractive. And then what happens if the bill is denied? Very important. Okay, you can always go back and ask why and get the explanation. Health share plans are really designed. You do really want to be living a faithful lifestyle. So there would be some situations there to where if you were not living a healthy lifestyle, or and I'm talking a lot about like drugs and alcohol. If you had instances related to drugs and alcohol, those could possibly not be covered. So that's a consideration for some folks. Okay, so the big thing is just you really need to look at these, talk about what the plans really will entail, and if this would really be something that would work for you, your family. I do sell other plans, short-term plans that help fit gap coverage, Medicare as well. But if you're on COBRA, coming off COBRA, or losing group coverage, give me a call, and you can call or text the number that's on the screen here, or shoot me an email. So thank you, and talk to you soon.